Well, welcome back from the break and welcome to this session on metrics that move systems change. The central question that we want to address in this session is what kinds of metrics can actually move systems? Metrics that don't just reflect what's happening, but actually motivate and drive decisions towards ambitions that we have for systems that are adapting and mitigating climate change and also delivering healthier, more equitable outcomes to everyone. As has already been really explored in the first session in this program, one of the most persistent gaps that we have across climate-focused systems change efforts has been underrepresentation of health, not only as a desired outcome to be protected, but also consideration of health as a lever, a driver for transformative climate action. Again, our conversation today aims to bring the health dimension to the forefront, looking not only at what's measurable, but what should be measured to enable meaningful systems change. So we're going to explore this question from several different vantage points. One of them is really centered on defining a set of metrics that credibly link climate change to health outcomes. And how can those metrics make visible and also make legitimate the links between climate and health that are too often being overlooked or even undervalued by decision makers? A second angle that we're going to be taking relates to how do we measure not just the end results, but also the enabling conditions, the system dynamics, and the process shifts that are going to produce those results. Are those intermediate indicators important in themselves for driving climate systems change? And another angle is how to design metrics that are credible, actionable, and actually embedded in world-wide decision systems, whether it's in budget processes at all levels of government, policy frameworks and regulatory frameworks, or the development and implementation of industry standards. So what also would all of this imply for additional investment that's needed in national and subnational statistical systems? And lastly, and ultimately, we're interested in discussing what role this commission can play. Can we help identify and also elevate metrics that are going to matter? Can we endorse some systems that are already in use? Should we be calling for the development of new ones and offering guidance on how metrics can be leveraged across global, national, and subnational efforts to achieve climate and health goals together? So to help us explore those questions, we're going to begin with four brief presentations, each from an individual who's got a unique perspective and real-world experience about how metrics can function as levers for systems change. Then we're going to move into a moderated panel discussion, followed by an opportunity for Q&A, both from commissioners and from everybody participating in the audience. So commissioners, use the chat function for your questions, and audience members, please use Slido to enter your questions. So now let's move to the first speaker, and I'd like to introduce Dr. Kristie Ebi, who's a professor of global health and environmental and occupational health sciences at the University of Washington. Chris, over to you.
Thank you very much. I really appreciate the opportunity to talk with you. I will elaborate on some comments that Andy made in the earlier session about a set of sophisticated statistical tools that have been used extensively in the climate community to address the question, how do we know? This question came from skeptics early in the process of assessments, asking scientists how they could claim they knew that climate change was occurring and that it was affecting our weather patterns. Next slide, please. The slide is from Ben Santer, the father of detection and attribution, pointing out across the Intergovernmental Panel on Climate Change assessment reports the headline findings that have come out from each of these are fundamentally based on detection and attribution. That's why these statements were powerful at the time. They helped move policy. That's why they received the attention that they did, and they continue to receive that attention. Next slide, please. Detection and attribution does exactly what the name implies. The first is detecting whether there's been a change, that heat-related mortality, has it shifted because of long-term trends, because of a particular extreme event. And so the first part is understanding whether there's been a change. If there has been a change, then the attribution portion of the analysis looks at the relative contributions of multiple possible causal factors. Next slide, please. For health, detection and attribution started with extreme events, and I'll use the Pacific heat dome in the Pacific Northwest. There was a rapid detection and attribution study of this event that concluded the event was virtually impossible without climate change. Therefore, if it was virtually impossible without climate change, any of the excess deaths that occurred during this event over the course of a week or so would then be because of climate change. It took about a year, but the data from the state of Washington showed that there's more than 440 excess deaths that occurred during this event. These are more than 440 people who died because of climate change. This changes the discussion. It's moving the health sector from talking about associations, from talking about possibilities, from talking about what we understand from first principles, to saying we can start counting how many people are dying from climate change. Next slide, please. The field is evolving quite rapidly. I have several slides showing you some of the ways detection and attribution for health is shifting. This is a modeling study that came out based on a multi-model comparison project on detection and attribution from the climate community. Looked at 43 countries around the world, more than 700 locations in those countries. And this shows the proportion of heat-related mortality over about the last couple of decades that could be attributable to human-induced climate change. Overall, the answer was about 37%. You can see lots of variability around the world. You can see that there's one country for all of Africa. So lots of work needs to be done, and a very important first step to start showing we can count how many people are now dying from climate change. Next slide, please. Detection attribution is fundamentally an interdisciplinary process. This is an illustration of working across the climate community and the health community to attribute to an extreme event the number of, in this case, it would be deaths that occurred from climate change. Next slide, please. This is what it looks like in practice. I'm not going to go through this, but it is to emphasize it is a complex process, well-established statistical methods that starts from modeling the relationship between heat and mortality, processing climate data, doing the impact attribution, and the event attribution. Next slide, please. There's analyses such as this one that was done for Switzerland that were used in lawsuits. And I should have mentioned at the beginning the ruling this week from the International Court of Justice on climate change is deeply based on detection and attribution studies. In this case, these analyses were used in a lawsuit in Switzerland from older women saying that the Swiss government was not protecting them during heat waves, and they did win. Next slide, please. It's not just heat. There's been efforts in other domains of health. Here's an example from Canada for Lyme disease emergence. You can see in the map over the course of 7 years, a very strong increase in the incidence of Lyme disease in Eastern Ontario. Separately, there was detection and attribution on the changes in the underlying temperatures that are driving that emergence by Environment Canada, and that analysis concluded that the temperature change in this region of Canada, in fact, across all of Canada, is because of climate change. So we're now seeing studies looking at morbidity that can be attributed to climate change. Next slide, please. For those of you who were unaware, there was a massive outbreak of dengue around the world, particularly in the Americas, in 2024. The previous record for the number of cases for dengue fever, and these are reported cases, most cases are not reported. The last record was in 2023 when there was over 4.6 million cases of dengue fever reported. In February of 2024, Brazil forecast that it alone would have more than 4 million cases. In the end, there was more than 12 million suspected cases. And you can see the epidemic curve on the bottom. States of emergency were declared in Honduras, Peru, and more than 17 Brazilian cities because of the massive increase in the number of cases. There were more than 7,000 deaths from dengue hemorrhagic fever. Next slide, please. And I put this in because separately there was a detection attribution study estimated the percent of dengue due to existing climate change in the Americas and Brazil. The study concluded that somewhere between 35 and 40% of dengue fever in parts of Central and South America is because of climate change. 35 to 40% of 12 million people is a lot of people being affected. Next slide, please. I want to thank you for listening, and hopefully I've convinced you that these are powerful tools that can be used to start quantifying the observed impacts climate change is having on our health and our well-being. And I'm pleased to say that 2 days ago, there was a paper, a guidance paper on how to do these studies that was published in Climatic Change. Thank you.
Thank you, Dr. Ebi. Next up is Dr. Romanello, Marina Romanello, who is the executive director at the Lancet Countdown, and she's based at University College of London's Institute for Global Health. Marina, over to you. You're on mute, Marina.
Thank you so much for that. I'm great to have been muted. As you just heard, I lead the Lancet Countdown on Health and Climate Change, which is a big collaborative research project based off University College London at UCL, but involving over 300 researchers from more than 100 institutions globally. Next slide, please. So every year we publish updates of indicators monitoring the links between health and climate change. The latest report we published it last year ahead of the COP climate negotiations in October 2024. And that paper had perhaps some of the most concerning findings in the 8 years in which we have done these annual publications, in that out of the 15 indicators in which we're monitoring the evolving risks, exposures, and impacts of climate change on health or climate variables on health, we saw that 10 reached a concerning new record. And you can see that as a heat map with each indicator represented as a row on the screen, very clear trend towards increasing risks, exposures, and impacts. Now, I did want to note here that what we're measuring here is either exposures to changing climate variables or impacts or risks attributable to changing climate variables, but I think Chris just put it very well. It's very important to note that oftentimes we do not do attribution to anthropogenic climate change, but rather to a change in a climate variable that can or not be linked to anthropogenic climate change. Next slide, please. The 2023 report, so the year before then, we had done some projections of what the future might hold, even if we managed to keep within the highest threshold set out in the Paris Agreement of keeping global mean temperature rise to under 2 degrees above pre-industrial time by the end of the century. So even under such a scenario, we estimate that by mid-century, so already in about 25 years, we would see a sharp increase in most, if not all, of the risks that we're monitoring, including heat-related deaths, the loss of labor supply, labor capacity, and risks to workers, increase in food insecurity linked to the increased frequency of extreme weather events, and the increased environmental susceptibility for the transmission of deadly infectious diseases like malaria, dengue, chikungunya, Zika, Lyme, and many others. So the situation we're under is that we keep on seeing the growing health risks and impacts of climate change. And even under the current kind of 1.3 degrees of average global mean heating, we're still seeing that we have not adapted well enough to the current levels of heating. We're seeing a growth in the impacts of climate change that we think could largely be avoided at the current levels of heating. And we're seeing that we're heading to a very dangerous scenario. These are the estimates under a 2-degree world by the end of the century, but it's important to note that current activities and actions put the world on track to 2.7 degrees of heating. So all of these impacts would probably be exacerbated unless we take urgent action to curb emissions. Next slide, please. And obviously, this has to do with not only our delays in adaptation, but also our delays in tackling our greenhouse gas emissions. And I wanted to note here a bit what the data shows about what's happening in the energy sector, the biggest single contributor to global greenhouse gas emissions, and a sector that we do have the technology and the capacity to decarbonize. So as you can see on screen, far from falling, our emissions from the energy sector keep rising year on year, leading to accumulated greenhouse gases in the atmosphere. We've reached record high levels in 2022, again in 2023, and we have preliminary data that indicate that 2024 was another year of record high emissions. The positive news is that our growth in the adoption of clean renewable energies is much faster than had been predicted. However, the use of those clean renewables is very unequal, as you can see in the bottom graphs there, very unequal globally, with countries with low human development index, generally lower income countries, more vulnerable countries, being left behind in the transition to clean renewable energy. That is worth noting that energy is cheaper, is available off-grid, could be available to remote places if a just allocation of resources and transfer of technology takes place. Next slide, please. And this is very important for health. I was just following the discussion about the health co-benefits of climate change and the dilemma around shaping it as co-benefits. And here it's also important to note that the missed opportunity of delivering health gains through climate action, through tackling greenhouse gas emissions, is one and the same problem. So we're seeing that this delay in the transition to clean renewables has also meant that millions of people globally still don't have access to clean energy to meet their household energy needs, accounting that energy is often fundamental to good health. And we're also seeing that the persistent use of solid household fuels, biomass, and solid coal and solid fuels, which is a symptom of energy poverty, is resulting every year in about 2.3 million deaths from household air pollution across the 65 countries that most depend on solid fuels and technologies for cooking. As you can see on screen, with big inequities between rural and urban populations, with rural ones disproportionately affected. And of course, also the contribution to ambient air pollution with fossil fuels, contributing to an estimated 2.1 million of deaths in the attribution of current deaths. There's a very interesting study by Jos Lelyeveld and Andy Haynes that shows that the phase out of fossil fuels could lead to way more than this number of lives saved as well. Next slide, please. The agricultural sector is another sector where we need to unify actions in terms of improved diet and tackling environmental pressures and climate change. We know that the production of red meat and the animal rearing is the biggest single contributor to agricultural emissions and also a key driver of deforestation. And we know that red meat and dairy production contributes to more than 50% of agricultural emissions, which is one of the biggest contributors after fossil fuel to global greenhouse gases and climate change as a result. And the flip side of this is that the overconsumption of red meat is not only driving environmental harm, but also leading to very high burden of disease from unhealthy diets. And the transition to the so-called planetary diet or the Eat Lancet diet could help us save up to 11.2 million deaths. Now, of course, that transition has to be culturally sensitive, but that showcases the enormous opportunity for saving lives through a joint transition in our agricultural and food system for healthier determinants. Next slide, please. So I've shown you some of the indicators that the Lancet Countdown puts forward. As you will have seen, these indicators are quite top-down. They're based on scientific models, and in general, they're global or regional, with only a few of our regional centers producing country-level estimates based on national metrics. But the use of indicators is very varied. There's many reasons for which indicators are useful. They can help monitor evolving situations, identify risks. That's largely what we do with our indicators at Lancet Countdown. They can be used to inform policymaking and the prioritization of resources. But they have other uses as well that are a bit further away from what we do at Lancet Countdown. For example, benchmarking and setting targets, monitoring progress against those targets, particularly within policy processes, support the evaluation of interventions, which is a huge gap that we have in understanding what works and what doesn't, enable systems for accountability, mobilize political will and public awareness and support for climate action. So we only cover a small bit of this spectrum, and there's many other efforts also in the production of indicators. Next slide, please. So at this moment, there are many important development of indicators and political negotiations going on around indicators on climate change and health. I'm mentioning on screen a few. Perhaps the most notable that is ongoing is the one on the global goal on adaptation, for which we are working as part of an expert group in defining indicators to monitor progress against the global goal on adaptation for the Paris Agreement. The WHO also has, as part of their General Program of Work 14, that, as you will know, has tackling climate change as the first strategic priority. That global action plan also is accompanied by a set of indicators to monitor progress on delivering those ambitions. The Brazilian COP presidency has also put forward an action plan for the adaptation of health sector to climate change, for which also they are seeking to have indicators developed. Many countries are developing indicators for their VNAs and their NAPs at the moment, and we also are seeing a huge increase in the countries that are developing their national observatories on climate change and health. So all of these efforts at some point will need to be aligned to ensure that we're not overwhelming countries with the need for data collection and reporting, but also that the way in which we're defining progress is aligned, and it does accompany action for improved health and well-being. Next slide, please. So in many of these different processes of developing indicators, each of them have their own framework for indicators. So I don't expect anyone to be able to read this slide, but just to note, there's very, very many different ways of developing frameworks for indicators, and each of them will be tailored and optimized for the purpose that indicators are being developed for. So there's very good justification for each process having its own framework. However, sometimes there's not so much of a reasonable assumption behind why we should have a new framework. So I did want to call out that there are very many frameworks around, and we must pursue efforts to ensure that we have an aligned understanding with obviously the nuances that each process requires. Next slide, please. And then in terms of the gaps and challenges we've been observing through the various processes indicator development. I have put some of them here on screen. Many of these will be not news to you. We're very often dependent on models for indicators rather than observed impact. And oftentimes we're looking at mortality and not so much at morbidity. That is a less extreme outcome of impact. That limits our capacity to have a real-time assessment of the evolving impact of climate change and other hazards that also accounts for the impact and influence of adaptation efforts. Chris already exposed the importance of climate attribution and the challenges there, so we'll not stop on that much. I also wanted to note that data, even when it comes from countries, is very rarely disaggregated by relevant population groups, which means that oftentimes our assessment through indicators is blind to inequalities or to the impact of our climate action in reducing inequities on health. We also find very frequently that the geographical and temporal resolution of the data that underpins indicators is not enough. This is particularly relevant for small countries, including small island developing states, where our gridded data, the data that we have from satellites, often does not pick up the local realities for those small countries. When we develop indicators, we also have the problem that each indicator is a self-standing model or a self-standing metric, and often they miss out on the compounding, cascading, and system-wide impacts of climate change. So they can hinder a systems-wide analysis, and it's very important to interpret them in the context of one another. And finally, another issue that we're seeing, particularly as there's so many different efforts ongoing in terms of developing indicators, there's a big lack of harmonization in how we define indicators and how we report them, which can generate confusion, can fuel climate skepticism and denialism if it's perceived that we're throwing around many different numbers and fuels that we don't seem to know what we're talking about, as we often hear. So I know that the Office of National Statistics in the UK has an incredible project going on in terms of standardizing metrics on climate change impact. Through the Global Goal on Adaptation, we're doing something similar in terms of monitoring adaptation. And through the WHO's ATTACH, we're leading a working group or task team on the development and standardization of indicators too, that hopefully will help us move a bit closer to having common understandings and common definitions for standardization and harmonization. Next slide, please. One last thing that I wanted to note very quickly is that within the Lancet Countdown, we ourselves are updating our indicator framework. And aside from reviewing the literature and ensuring that we're on top of the latest scientific developments, we're also very interested in engaging with key stakeholders that use our indicators. So we will be rolling out a stakeholder consultation to ensure that the indicators that we put forward are relevant and impactful, and obviously that we're aligning as much as possible with other efforts for indicator development as well as we do. Next slide, please. And yeah, that's all from my end, and thank you very much for your attention.
Well, thank you so much, Marina, and also thank you for that very forward-looking end with some of the gaps and challenges and work that's ongoing. That was very informative. Next up is Cassie Flynn, who's the Global Director of Climate Change at the UN Development Program. Cassie.
Thank you so much, Kathy, and it's such a pleasure to be here and to be a part of this conversation. We'll just dive into the first slide, please. So to give a bit of a compliment to what Chris and Marina were talking about, the United Nations Development Program has an immense climate change portfolio. It's actually the largest in the UN system. It's over 130 countries. It's over 2 billion in grants for adaptation and mitigation. And our real goal is to help countries to realize the goals of the Paris Agreement. And this includes everything that's in there on climate, but also what it means for sustainable development. And here we focus on sort of three big pillars with this. You can see here about acceleration, ambition, and inclusivity. And when it comes to tackling this issue of health, well-being metrics, there is one side of it that is all about how can we ensure that we have accuracy and precision in what we are talking about, but also this political reality of what this looks like in some of these political processes. And I want to talk a little bit about what that bridge is, and really build on the excellent presentations by both Chris and Marina. Next slide. So I want to focus here on sort of three big levers: making the climate development case, making the policy case, and making the economic case. And, I really think, and both Chris and Marina used examples of dengue, and we're certainly seeing that in a lot of the work that we're doing. And, just recently, we were talking about how in Bhutan, dengue didn't exist 20 years ago. And now, because of increasing temperatures and of course you're getting more mosquitoes, and dengue is starting to spread, and it's putting a strain on health clinics. It's putting a strain on hospitals to be able to deal with this. And so we've been working with Bhutan to figure out how to tackle this within these decision-making processes. What does it mean to start putting disease safeguards into national adaptation plans, water sanitation, disease monitoring and surveillance, and to be able to take a lot of the work that Chris and Marina were talking about sort of detection and attribution to looking at the health threats from delayed action, and trying to put that in this national context in a place like Bhutan, so that the leaders in Bhutan have what they need to be able to bring climate development health together, to accelerate the decision making and to be able to drive systemic change, and to be able to do the systems, not just systems thinking, but systems doing, as we heard so much in that very first session. So let's dive into that first slide on climate and development. Next slide. Great. So, of course, we hear a lot about these impacts of climate change on health systems, and of what it means to invest in health systems on climate. And when we link this to issues of development, we've seen this actually go further within government decision making. And this is something that's really important, that we're not just talking about sort of strict greenhouse gas emissions reductions, but actually, how does providing clean energy, solar panels on rooftops, how does that actually help in the provision of care for communities and for countries? And how do we start to look at this, as we've heard so much, in a holistic way? How do you look at it from an integrated perspective? And we see this a lot. We've got, this is a picture here of our Solar for Health initiative, and 1 in 4 health facilities across sub-Saharan Africa don't have access to electricity. And so there's no electricity to provide support for light bulbs, for equipment, for computers, for refrigeration, and it completely shapes the ability of care that can be provided to these, in particular, rural communities. And so what we've been trying to do, of course, is how do we start to support decision makers to be able to make this development case for clean energy in the health sector, and looking at not only how does it help power these health facilities, but also what does that mean for jobs? What does this mean for the stability of a community? And so when those climate impacts strike, not if, but when they strike, or when potentially a community is in a fragile setting, we've seen this across places like Libya and South Sudan, how can access to this clean energy also help create a more stable and thriving community when faced with these challenges? And to be able to make this case directly in the context in which the countries and the communities are working is something that has helped, I think, the conversation around health really start to advance. Next slide. And these are some of the metrics where we've been trying to do this. And this is where the work of all the speakers on this panel and in the previous session, we're really trying to soak up all of this fantastic work into how can we talk with governments about these sort of multi-sectoral, multi-solutions, this way of thinking in an integrated way to help decision makers get what they need to be able to push on these issues. And you can see some of these examples here across energy access, health system impacts, climate and environmental impacts, socioeconomic and gender, and implementation and sustainability, really trying to look at this in this holistic way. So go to the next slide, please. So now with the policy case, and Marina mentioned the Conference of the Parties, the COPs. They, of course, are an immense political moment every year. And this year in Brazil is a particularly big moment for a couple of reasons. The first is that it is the 10-year anniversary of the Paris Agreement. And so as we look at multilateralism being questioned, as we look at climate being questioned, the discussion around, does the Paris Agreement work? Does the Paris Agreement help to usher in the transformation that is needed is really sort of top of mind. And the second reason why this conference is going to be so important is because every country in the world is meant to submit an NDC, a nationally determined contribution. These are these pledges under the Paris Agreement. Every country is meant to put one forward. And when we've seen across these NDCs immense opportunities, 100% of them talk about energy, 95% of them talk about adaptation and resilience, 90% of them talk about nature. And what's really interesting, we're seeing health dramatically increase in terms of these climate pledges at the national level. So countries are meant to put these in every 5 years. And 5 years ago, health was in probably about 70% of them. Now, as the new ones are coming in, over 90% of them are talking about health. They're talking about it sort of this big impact way. But we're seeing a complete drop-off when we talk about sort of the health benefits of climate mitigation and health priorities within adaptation. So in other words, it's there conceptually, but it's not there in the specifics. It's not there in the targets or the specific indicators referenced in these national targets. And so again, really needing to help build that bridge between sort of what's happening in these policy discussions with the specifics of the indicators and how we can look at this in a truly integrated way that I think is one of our challenges as we move forward. And you can see here, this is an example out of Nepal, who has centered their national climate plan on issues of health. They explicitly recognize air pollution. They talk about it in a multi-sectoral way. They talk about it in a way to reduce emissions, but also being able to increase climate resilient health infrastructure as an opportunity. And this is where countries like Nepal are trying to also start to attract the levels of finance that they need to be able to achieve these goals, which is, of course, absolutely critical. Next slide. So speaking of finance, the third element is, of course, the economic case. More and more, we are seeing our partners across governments, across communities, really wanting to be able to put the numbers to this in terms of the economic case for health actions. And of course, we hear a lot about the number of labor hours that are lost, the economic losses globally, the number of premature deaths. All of these are so critically important. And what we have to do, and I think others have talked about this as well, is contextualize this country by country, ensuring that countries and communities know what this means directly for them. That we may have over 500 billion potential labor hours lost, but what does that mean for a specific place? And what does that mean for how they need to start thinking about the future? So if we head to this next slide, we're trying to help some countries with a particular methodology start to really unpack this. And here's an example from Ethiopia. They've developed a multi-sectoral action plan for air pollution and health that draws upon the investment case, and they've costed it. And some of these numbers are quite astounding, that household air pollution in Ethiopia causes 39,000 deaths and 8 billion in economic losses in 1 year. It's really quite remarkable. And it's because in Ethiopia, you have a lot of traditional stoves for cooking, in particular in rural areas, and it's all about that indoor air pollution, which is, of course, very harmful, particular women and children who are most exposed to this smoke at home. And so when we start to put numbers on this, and we look at this across these three metrics, and you can see here the health and the social burden. Of course, this is about healthcare, loss of productivity, premature death, and illness. That real direct impact of breathing in that smoke. And then the environmental losses, the losses in particular of trees for fuel. And really starting to see the uptake of these environmental losses. And then the time losses. Fuel wood takes several hours to collect. It's very difficult to collect. It is often women and children collecting it. And when it takes that long, children are not in school. Women are not getting in paid work. And so you start to see this impact, not just for that particular family or that particular community, but you start to see it over generations. That when you have a family that has lost all of that time, the opportunities start to diminish, and that affects future generations. And you start to see a spiral and a downward case of development because of this issue. And so what we're trying to do with all of this, and certainly with this climate and development case, with this policy case, with this economic case, how can we equip leaders and decision makers in the context of this critical moment of the Paris Agreement to really put health at the center and to see it as this cross-cutting integrated issue, and to give them the immense amount of data and analysis that we can look to, and to look to these metrics, but help it to build the political will that is necessary and the leadership that is necessary for countries to really rise to the occasion and to be able to transform their economies in the way that can address both this dramatic impacts we're seeing on climate, and of course the dramatic impacts we're seeing. So last slide, I will stop there, and thank you so much. Looking forward to the conversation.
Great. Thank you, Cassie. And also thanks for contributing some case studies for us to considering. Our fourth member of the panel is Dr. Lorna Benton, who's a research fellow in planetary health at the London School of Hygiene and Tropical Medicine, and a contributor to the Pathfinder Initiative. So Lorna, over to you.
Thank you so much. It's a pleasure to be here, and thanks so much to my panelists who have contributed really thoughtful interventions so far. I'm coming from the Pathfinder Initiative, as we've just heard, and we focus a lot on climate mitigation actions with health co-benefits, and we work with urban network partners like C40, CDP, OECD, Hot or Cool, and SDFN. So just to flag, that's the perspective I'll be bringing today. So next slide, please. Thank you. So rather unconventionally, I'm going to start with a few key messages up front, and that's because I hope to show you that evaluating the health benefits of climate action is essential, and it's essential to provide a more complete picture of not only effectiveness, but efficiency of implemented efforts. And a well-designed evaluation can provide that accountability and inform more ambitious and accelerated action. And I think we heard in April's session that trust is very essential in evidence. So I'll aim to cover some of the key considerations that span the design, implementation, and evaluation phases of climate and health actions, and highlight some of the nuances that we're wrestling with at the Pathfinder Initiative. So next slide, please. Thank you. So many evaluation challenges can actually arise at that point of design, both policy and evaluation design. So in speaking with our urban network partners and members of C40 cities, we're really aware of the potential for health-related data to shape windows of opportunity for climate action. So, for example, in Delhi, it became really impossible to ignore that link between air pollution and health, where PM 2.5 data and respiratory health data deemed it a crisis. And in Paris, the availability of viable policy solutions like low emission zones and expanded bike lanes really aligned with public awareness of road traffic incident and air pollutant data. So there are many positive case studies, and still we find the use of health co-benefit data remains really ad hoc, quite siloed, and very difficult to integrate into systemic decision-making processes. Next slide, please. And it can be a challenge for decision makers to bring together both data and expertise across climate and health. And this slide just signposts to some resources that are available to actors, like the Health Economic Assessment Tool. We've got Climate H, Craft, Carbon H, and AirQ Plus. These kind of tools help decision makers to estimate the potential health and economic impacts of selected policies to prioritize actions in their settings. And that's important, but a challenge of relying solely on estimations or modeling approaches in general is that assumptions need to be made and they can remain untested. And we don't then understand the real world impact once policy is introduced, including the scale and the equity of any realized co-benefit. Next slide, please. Thank you. So briefly put, without well-designed evaluations, we won't know if climate actions have met their policy goals, had any unintended harms, or if the most efficient action was chosen for that setting. And we've heard some of the benefits of monitoring the evaluation. And I think if I just focus in on the accountability aspect that's been raised multiple times, evaluations can consider even, was this action ambitious enough? Could alternative actions have more effectively addressed goals? Or what was the cost of inaction? And we also heard it's really possible that issues of accountability will become increasingly prominent as legal arguments and structures advance. If I can have the next slide, please. Thank you. So many will have seen this diagram before, but I find it's a helpful illustration of the pathways to health co-impacts when thinking about metric development. And as some background, Pathfinder Phase 1 conducted an umbrella review and synthesized published evidence from climate actions that also report on health co-impacts. So they found literature from 7 sectors and also across multi-sectoral actions. And the 3 key pathways upon which these actions contribute to improved health outcomes, where you can see air pollution, diets, and physical activity. So for us at Pathfinder, improving the availability of data along these pathways is a really important place to start, so that we can start to test key assumptions about behavior change and health exposure following the introduction of climate actions. And next slide, please. Very briefly, thinking about what different health indicators can look like from climate actions. Successful implementation might be defined through metrics that demonstrate the actual delivery of initiatives. For example, the number of green spaces built, kilometers of bike lanes added, and the number of households retrofitted for energy efficiency. And that's different to related downstream metrics that evaluate the health outcomes of climate actions you can see on the right-hand side of the screen, like reduction in asthma incidence in children, improved physical activity rates, or decreased heat-related morbidity among older adults. So here, the outcomes can take more time to be achieved. They can rely on more complex methods to measure, and to attribute changes actually given to a policy or policy mix. So in the middle, we have these intermediate metrics or health exposure data, like shifts in travel mode or concentrations of specific air pollutants over time. And these become really essential in building that causal attribution. And so impact evaluations really wrestle with that attribution versus contribution of a policy to health outcomes. And generally speaking, we want to move as far over to the right-hand side as possible. And there are ways that we can do this. Next slide, please. So one case study is from the Victorian Healthy Homes programme in Victoria, Australia. where a randomized controlled trial approach was used to assess how low-cost home upgrades led to a number of outcomes like warmer homes, reduced breathlessness, achieved better mental health, and reduced healthcare costs, but also leading to a reduction in 5,778 tons of carbon dioxide equivalent emissions over the winter period. And this becomes a proof of concept for scalable action, not only in Victoria, but in similar settings. Next slide, please. And without turning this into a lecture on evaluation methods, I just want to emphasize that a randomized trial is not always feasible, nor is it always required. So alternative approaches can evaluate the climate and health co-impacts of policies. And here are just two common examples of approaches used. So if I take the example of interrupted time series analysis, this is an approach used to estimate policy impacts when data are available over time. So for example, in the city of Bradford in the UK, researchers use this approach to compare nitrogen dioxide levels and healthcare visits over time, both before and after the introduction of a clean air zone or a low emission zone. So I won't go into different in the interest of time, but there are common challenges, and that's what I really want to emphasize. So they persist across the data landscape, and that's really important when thinking about metrics. And they can limit the application of methods like these. So challenges exist like we've heard about limited availability of spatial resolution of data, seasonal fluctuations, and the incompleteness of monitoring data in general. The challenge might be in finding a suitable comparator or the lack of a long-term follow-up after a policy is introduced. And next slide, please. And so I believe in the April session, you heard a bit about the what of systems thinking. And now I'd like to briefly speak to the how and ways that the Pathfinder initiative is using mixed and contextually specific methods to evaluate change in the wider system. So with our partners at OECD and Hot or Cool, we're developing a pilot study to understand how systems thinking can support decision makers and actors to develop more transformative climate and health actions. And their work focuses on bringing together different departments, and we are identifying ways to assess the mental modes or models that underpin climate policy design. OECD also use causal loop diagrams in their work to map out those positive and negative feedback loops affecting achievement of sustainable mobility goals. And with C40, we're using contribution analysis for high impact policy case studies where traditional attribution methods are not feasible. So the use of program theory can identify and measure steps along both those hypothesized and alternative pathways to impact, which become really important when thinking about trade-offs or unintended consequences. And bringing all of this together, we are developing guidance for researchers on best practice approaches to evaluation of implemented climate and health actions. And we've recently published a checklist to build upon this, though we'd like to move forward and co-design with experts across various settings and sectors. Next slide, please. So in developing this guidance, we recognize that implementation without robust evaluation can hide those harmful or inequitable impacts too. I think in the interest of time, I'll just focus on nature-based solutions here, and poorly designed or implemented nature-based solutions we know can create a lack of accountability that we've spoken to, and they can risk greenwashing if key outcomes are not measured and valued. So outcomes could look like carbon sequestration, air quality regulation, the urban cooling effects, or mental health benefits of a restored landscape. Without such data, though, we're unable to go one step further and estimate health outcomes like reduced hospital admissions or averted mortality. And the common theme across these examples on the slide is just the need for better evaluation designs so that we can communicate effectively, clearly, and correctly about climate action impacts. Next slide, please. And in these better evaluations, we need to measure the differential impacts of climate and health actions. So disaggregated metrics allow us to understand how healthcare impacts are or are not realized across demographics like gender, ethnicity, age, disability, and geography. And key equity indicators can track changes in vulnerable populations rather than just present averages. So an example could be London's ultra-low emission zone, which found that outcomes of cleaner air reductions in harmful nitrogen dioxide concentrations improved respiratory health outcomes, but also meant a reduction in health inequalities, particularly for those in more deprived areas and communities of colour. And just to focus in on participatory methods, as that came up in the introduction, that can really support the optimal design of both an intervention and its evaluation. So one example could be an NGO, Health in Harmony, who undertook consultation and radical listening approaches to design a community-led intervention in Indonesia, and that reduced illegal logging by up to 70% and improved access to healthcare for over 28,400 patients. The key ingredient here was recognising lack of access to healthcare as a driver for illegal logging. So next slide, please. Thank you. I hope in this brief presentation, I've managed to demonstrate that evaluations of climate and health actions are both necessary and possible, and a collective effort is also needed to address some of these existing challenges that we face. In this slide, I propose 10 immediate steps that can be taken. In summary, the shared and systemic drivers of climate change and ill health need to be understood for any of the given contexts. Action can strive for inclusivity, set clear objectives, and make efforts to identify those unintended outcomes. Indicators will need to span the near and the longer term, measuring equity and vulnerability as we go. For this, mixed methods already exist and can be further adapted. But as we strive to build a more complete picture of the evidence landscape, we'll need more evaluations that report standardized metrics, like greenhouse gas equivalent reductions and morbidity or mortality outcomes, for example, disability-adjusted life years or years of life lost. And finally, we encourage decision makers to demand more than modelled estimates and to make evaluation an integral and resource part of their policy design. Thank you very much for your time.
Thank you so much, Lorna. We're now going to transition into a discussion among the panel members. So please come back on camera. And what I'd like to do is to address Marina and to ask you to think at the systems level and what to consider what a health-informed systems transformation would look like, and how would we measure it? And would this vary across sectors and institutions and geographies? And what kind of indicators might help distinguish some kind of incremental improvement from a really grand structural transformational change?
Thank you, Cassie. So if I understood correctly, your question has to do with the type of indicators that we could develop or we should aim to develop to monitor a system-wide transformation of health systems. That is a really excellent question. There's a lot of discussion ongoing at the moment in terms of what that transition needs to look like. And one of the fundamental aspects of that is that the transition should not be restricted to health systems if we want a comprehensive transition in terms of adaptation, mitigation, and safer futures. So as a fundamental, perhaps, cornerstone to answer that question is perhaps that the indicators that we should be developing, should not be focused solely on health systems, rather than reflecting transitions in all the systems that support health. And then the second aspect of it is the type of indicators that we need to be developing. So up until now, much of the focus in terms of monitoring health system transformation has been focused on what we came to call kind of process-based indicators, that are indicators that monitor what health systems have done. Have you done a VNA assessment? Have you done a risk assessment? Have you developed a plan? Have you implemented your plan? But not indicators that have that measure or support an assessment of the outcome of those efforts. So as a priority, I think where we need to start putting our efforts now is in developing indicators that can help measure the outcome of our adaptation efforts. And those outcomes are to be measured in terms of improvements in human health and human well-being across the multiple dimensions that define human health and well-being, but in a way that is that can be related to adaptation interventions. So there is where indicators alone become really restrictive, because we can monitor the change in mortality or morbidity, but the fundamental aspect there is to be able to link it to adaptation interventions or to mitigation interventions. There's another very big discussion about attribution to an intervention. That is yet another layer of complexity. And that is where we need to start aiming our efforts. First, understanding that health outcomes should be the cornerstone of all of our actions to tackle climate change, and that ultimately the actions that we take in our economic systems, in our infrastructure, in our sanitation systems will have health effects. And then monitoring those impacts on health with a more comprehensive assessment of the interventions that have been implemented will allow us to understand much better the extent to which those have been effective or not. And I think in that sense, Lorna's discussion just now, how do we evaluate interventions, becomes a crucial aspect of that. It's not just about the indicators. They fall really short in terms of understanding effectiveness or not of that transformation.
Thanks, Marina. Lorna, you've been nodding as she's been talking. Do you want to add to that?
Well, just to say, I agree, of course, and perhaps it's a bit of a friendly audience, but I think also when I was listening, I was thinking, what does it look like? And I think it looks like these norm shifts and these mindsets that I just mentioned that really need to happen before we see any kind of structural changes or behavioral changes, even that become very measurable. And it makes me think of one of the big challenges that Andy and Sarah Whitney identified in their 2015 paper, which is the challenge of imagination. It's not a metric, but I think it becomes a real big foundation to a lot of what we're discussing today. I could speak more to that, but I'll give time back to the panel.
Lorna, sorry, if I can add on to that, there's a very interesting aspect also, that is how do we monitor the enablers of those actions, both in terms of financial enablers and in terms of governance enablers that are oftentimes the biggest barriers that we find in terms of transformation has to do with governance. And that is very difficult to measure with self-standing indicators, but indicators can help shape a picture and expose different elements of those barriers and enablers that can support a system-wide transformation.
Thank you both. Now, Cassie, I want to turn to you. Also, thinking big, transformational change, but what makes a metric actionable? I mean, certainly building on this conversation, having some process or intermediary metrics is important, but from your vantage point, what makes it actionable that a government would act, that a private sector organization would act? What is it about a metric that drives action?
Yeah, it's such a good question, and I think also building on what Lorna and Marina were saying, this idea also of the enablers for when a government starts to make a decision, if they have the political will to be able to make this decision, then how do you begin to enact this, and how can you measure this? And I think that we talk a lot about this, about no big policy decision on climate change is made in isolation. And one example is we talk a lot about the rule of law, because when you start thinking about investments, and whether it is let's say it's investments in solar panels on the rooftop of a health facility, to drive that level of investment, you often need to attract private sector investment. And private sector investment, we hear from investors all the time. They want to know that there's a solid rule of law, because they know if something goes wrong, they know where to go within that country. And it's not something that you would normally associate specifically with climate or health in that sort of traditional way, but has a profound implication for what it means to drive finance toward a solution. And I think being able to connect all of this again, and I think one of the big themes here is this integration. Being able to do that for policymakers, I think will also you start to see things unlock when you think about that environment in which these policy choices are made.
And what your experience with the private sector also would be meaningful here. Certainly, you talked about the necessity for making the economic argument for these decisions, but are there, within your realm of experience, again, specific metrics that have been particularly important in driving change in the private sector?
Certainly when we speak with, and we've had this challenge recently, actually, with, as I mentioned, all of these nationally determined contributions under the Paris Agreement are meant to come in the door. And it's quite a profound exercise in that when you add all of them together, they will tell us how far off we are from 1.5, right? They will also give us insights into the priorities of nearly every country in the world for the next 5 to 10 years on climate. And so looking at how, in particular, health interacts with that is a very big signal to the private sector. And so the private sector, of course, they talk about wanting stability a lot. They talk about wanting to de-risk, and this looks very different across countries. And even I think in the chat here, I'm seeing someone say that, foreign investment comes at a very high rate. Many countries pay more in debt service and in interest payments than they do on their healthcare systems or they do on climate. And this is a trap that many countries can find themselves in. And so again, how we can help to create a system that has stable policy signals, has a strong rule of law, strong governance, to be able to track that level of private sector, but also how we use that to inform the global conversation around how finance flows around the world and what it means for countries that are in vast amounts of debt, that have faced incredible difficulties being able to attract levels of finance because the risk, the view of risk is too high. And also what we need to do about this. Chris mentioned the ICJ ruling that came out. I think this is also a really important signal to the world about how seriously we need to take this and the systems that have to change at the global alongside the national level.
Thanks, Cassie. And Chris, turning to you, Marina raised the fact that there are quite a few gaps in our things that we're failing to measure with respect to climate and health. And what do you see as those gaps, and what are we missing by not having that information?
There is an enormous opportunity to use qualitative information that the health sector is not taking advantage of. The health sector, for historic reasons, has moved to everything has to be data-driven and ignores the enormous expertise of all their healthcare providers on the ground. I've had the privilege of working in many countries, and I've yet to work with somebody in a Ministry of Health that doesn't, if they're in the diarrheal disease control program, you talk to them about climate change, they know what's going to happen. They may not have the projections, they have the expertise. And there are discussions, certainly in detection and attribution, but in other areas of health as well, to take advantage of all of the sources of information that we have, even as we build the quantitative databases.
And finally, Lorna, let me address a question to you, and then I'm going to open it up. So if any of our commissioners or audience members have questions, please put them into the chat. But But Lorna, what are the risks if we don't align our metrics across different decision spaces? And how do we design that kind of cross-cutting set that will be important to drive action in those different sectors?
Thank you. Well, actually, just building on the conversation, what I was thinking is there's no coincidence that I think the SDGs have a 17th target on partnerships. And I think a lot of what we're failing to measure might be how we're working together in that kind of process. But to answer your question more specifically, what happens if we don't align to the metrics to decision spaces? We're going to miss opportunities to act on synergies. We're going to miss those opportunities to partner with people with expertise. There's no way forward without collaboration. And I think the benefit of metrics is that they provide that shared target for partnerships to work together and kind of break down the pieces of the puzzle that they can manage on their own. That said, we don't want to overburden, and I think Marina made this point, it's really important that we don't overwhelm actors with metrics. And one of the things we seek to do in our work is to find out what are those key metrics upon which different actors in a city might align and kind of bring that together. And then I think the point I also just wanted to make is that we fairly make these assumptions that value of economics is a driver. But I want to remind us, as I'm sure we all know, this is a conversation about values a lot of the time, and that will vary between place and people. And we did hear a bit about that in the beginning. So just considering that contextual relevance and appropriateness in any conversation we're having as we move forward. Thanks.
Yeah, and thanks for tying us back to the introductory session. That is a very important point that emerged from that discussion. So I have quite a few questions here. First one, Cassie, is directed to you. And it is UNDP has done a phenomenal job on conducting research on and funding programs to address solid waste management, gender, and also climate change. Has UNDP looked at the interaction between the 1.5 billion waste tires produced each year, climate change, and dengue?
Well, thank you. Thank you for that question. I can't speak to the specifics of that relationship. I would have to defer to some colleagues on this, and happy to connect with some of the work. But to this sort of broader issue in terms of the sort of solid waste management in this, I think this is really critical as we're thinking about all of this, and something that we really focus on is how we can adopt integrated waste management systems, and to be able to do this in particular at the municipal level, and being able to tackle things like plastic within a value chain, promoting circular economy, ways that we can look at this again in this kind of holistic way, and being able to engage. I mean, especially with something like circular economy, you have to engage a variety of actors. And, Kathy, you asked about the private sector, in particular, we have to make sure that they are at the table, and also levels of accountability for some of the choices that the private sector are making. So.
Thanks, Cassie. The second question is to any member of the panel or all of you, but it comes from one of our commissioners. Could one create a subset of climate and health indicators that are more directly related to SDG 3 and SDG 2 targets and indicators? The challenge of countries collecting brand new indicators related to climate and health is real and could delay implementation. So Lorna, you want to kick that off?
I really agree with the premise, I think, in not overwhelming the world with more metrics, but also the alignment is there. And I think there's a scaffolding that we could build upon. But I was just thinking as I was nodding along that we have targets for non-communicable diseases. we could map pathways to those outcomes as we have done in the Pathfinder initiative. I think the only thing holding us back from achieving this is that level of coordination. And I think that's a common challenge at the kind of global governance level and national levels. And a problem we do see with the Sustainable Development Goals in general is bringing the global to the local. So I really agree with the premise. It's just the operationalization of it that I think would need some interrogation.
Kathy, you're muted.
I am muted. Thank you. I was asking, does anyone want to build on that? But you make a really good point.
A perspective I'm surprised hasn't been raised, particularly by Cassie, is using theories of change. And those have proved useful in the development context.
Mm-hmm.
And the kinds of questions that are being posed could begin to be addressed by looking at theories of change, looking at those internationally and nationally. I know that for UNDP, for their projects, they do require quite a lot of thought put into those theories of change and bring that into the broader discussion, not just within the development context.
Good. Chris, the next question is also from one of our commissioners, Jonathan Patz, to you. He says, you showed how attribution science has majorly advanced, so much so that it's being used to win lawsuits.
Mm-hmm.
What are the toughest current critiques of climate attribution at this point in time? And what are the top best answers to address doubt and such critiques?
It's a great question, Jonathan. There's 20 years of research on detection and attribution, more than 20 years on the climate science side. And so many of the questions, many of the concerns about the approaches have been addressed. There's a whole field now of extreme event attribution. There are issues that are arising. For example, in the Pacific heat dome, one of the biggest challenges is that the climate scientists look at their models. They pick out, as you know, there's a range of projections from any set of models. They pick out the extremes and look at how often what occurred you could find in the models. The Pacific heat dome you could not find in the models because it was so extreme. And there's questions now about the climate models themselves and what needs to be done to be able to pick up these very extreme events that obviously can occur because they are occurring, but the models are not replicating them. So there's some fundamental work that needs to be done on the climate models. On the health side, if you're going beyond extreme event attribution, one of the challenges is that the health sector doesn't have any baselines. We have standard baselines for all the climate models, but we don't have those baselines for health. They're ongoing, they're rolling baselines. And there's been calls, as you know, back to the first national climate assessment to develop some baselines to be used as the standards for comparison. And that's something that the health sector very much needs to work on. And then, of course, the collaboration is critically important to make sure that the studies that are done are robust. There's examples on both sides of climatologists doing detection attribution studies about health without talking to anybody in the health sector and not really having robust results. But the health sector is equally guilty of doing that, of doing detection attribution studies without having the input from the climatologists. And so finding and developing partnerships to make sure that the analyses are robust. There will be questions that will come up. You mentioned power. That was an issue in a paper we published several years ago where we had a qualitative detection and attribution related to some of the changes going on in the Arctic. One of the reviewers very much wanted to remove that from the paper because they felt the numbers were too small. and that it wasn't powerful enough. But if you have 10 people out of 100 in a village affected, that's a huge impact. And to, again, take advantage of qualitative information to understand the power of detection and attribution at all scales. And that will start moving policy in many different dimensions, particularly in the health dimension. One of the challenges we've faced in climate and health for the last decades is many ministries of health think climate change is a future issue. And the more we can do these analyses to say, no, it's happening now, it's part of your mandate, and it has to be addressed now.
We've got one more question from Commissioner Howie Frumpkin, and I think we've got enough time to do a lightning round asking each of you to comment on this. But he recognizes that this session we really focused on climate health links with respect to metrics. But in our first session, which was much more focused on equity and values as the discussion went on, that we were kind of in the discussion when it did touch on metrics was more process oriented. So he's wondering if we should turn to process issues from broader imagination to finance decisions. And do we need more focus on process indicators? And what would those look like? So Marina, why don't we start with you?
Yeah, I mean, I think that comes down to, I don't remember who, well, I think it was Chris that mentioned that we're quite still addicted in a way to metrics, and we are really dependent, or we rely a lot on these indicators. That what we can sell out of indicators can be quite limited. So I absolutely agree with Howie's comment, and taking it back to what we were discussing in the previous session, I think we have to have principles also in how we develop the indicators and what they capture. To give you an example, well, as I mentioned, we rarely disaggregate our indicators by relevant population groups. We rarely account for indigenous knowledge within the indicators that we develop. And those type of limitations often have to do with how the underlying data works. And if we're still going to rely on the indicators to tell us stories and to guide action, then we need to ensure that the indicators do account for those values that we've been discussing before, and that how we construct them, how we communicate them is sensitive to those values as well. So I think it's not perhaps, they're not mutually exclusive, but I do think that we have to take into account that previous discussion. Same with the health co-benefits. We have at Lancet a lot of indicators that talk about health co-benefits, because we're generally aiming at the climate negotiators that need to justify their investment for climate action. So they're focused on climate action, but absolutely agree. Oftentimes that's really limiting and really harmful for the populations that are affected by those harms that we could be addressing through system-wide change. And that's something that we can start doing in terms of how we communicate the indicators, how we construct them, and what are the topics that we monitor to ensure that those values are inherent to the metrics that we develop.
So Cassie, what's your thinking about process issues fundamental to measuring climate change action?
Yeah, I think I'll contribute sort of two that come to mind, that something has been very much on our minds, and the first is about institutional capacities within government. Often, and Chris, I think you mentioned this, that you have sometimes what people are, the climate part of government is in a particular ministry or set of ministries, and health can be separate. And we do need them to be talking to each other, but we also need them to have the capacities to engage in a longer term way. And so, and we've seen when this happens, there's ways that this integrated approach in terms of metrics and indicators and policies can be boosted. And one example is actually some of the work we did in Lao. They were very interested in sort of bringing together climate and health in terms of their early warning system. And so they wanted to put forward, start to measure, weather data, rainfall, temperature, humidity. And then they wanted to have a layer of that, which was all about being able to predict various outbreaks or disease, and being able to put those together. But it required ministries talking to each other and having the conversations, but also the capacities to be able to engage in this meaningful way. And I think this is something that when we talk about inclusion, there's this sort of very practical piece, even about inclusion of across ministries of government. And then, of course, with inclusion, really thinking about how we are engaging Indigenous groups, local communities, marginalized communities, frontline communities, through every step of the process. That there's thinking about sort of investments and design, but also being able to have sustained support and sustained engagement across these communities, and ensuring that we are measuring that in a meaningful way throughout the course of the decision-making process and beyond. So I would emphasize both. Thank you.
Chris, anything to add?
Sure. Howie, absolutely agree. We need both process and outcome indicators. There's been lots of work in other sectors that we can take advantage of to think about the kinds of process indicators that would be useful in the health sector. And to add to that, something that both you and Jonathan will undoubtedly remember is in the build-up to the first National Climate Assessment, Mike McGeehan went out and did a survey across the US of which communities had heat wave early warning systems. I don't remember the number, but it was sort of like in the range of like a dozen communities had those. And Mike asked if he could see those plans, and a whole pile of them just were in a piece of paper in a drawer. We do know there's lots that's been done in the field of implementation science and thinking about readiness, for example, as it's measured by the implementation frameworks. There's much we could take from those kinds of frameworks to improve our process indicators, to look at, as Cassie said, the capacity, but also the fact, have you actually done anything with your early warning system, or is it just sitting in a drawer?
Thanks, Chris. And Lorna, you get the final word on this question.
Thank you very much. That is a privilege. So yes, I really agree with the premise of this question. Once again, it was rather, I think, frustrating to see that so none of these concepts are new and obviously have been debated under the SDG kind of umbrella. And also when Andy and I were developing our checklist of guidance, we really recognize we don't want to reinvent the wheel. So I think all of these things do need to be addressed. I might just reframe whether they are process indicators or if they are ways of working and approaches. I think this issue of including different perspectives is imperative. And in our guidance, we really urge the inclusion of Indigenous ways of knowing. And I think in any participatory research, it's important to understand that the power sits with the question asker. So we also make assumptions about the very frameworks that we operate on a day-to-day basis. But I also wanted to thank Kristie for bringing up theories of change, because at least in my world of work, I am kind of worried I will become known as just for loving theories of change. And I think I really subscribe to that way of working. And it can bring together some of these issues around systems thinking. It can bring different actors together, and those kind of cross-sector collaborations often work really well when you have people in a room just with some visual or mental model on the table to start working with post-it notes. That said, I do think we can set some goals for coordination and think how partnerships or coordinated efforts translate into policy coherence. And on the point of institutional capacity, I think I could signpost to the work of OECD and Hotokul, where they are thinking very much about how to build that kind of institutional capacity with city level decision makers to start reimagining what is possible in their city using a kind of systems approach. I'll stop there. Thank you so much.
Thank you, Lorna. And I would like to close out this session, first of all, by thanking each one of you. You've done so much to set this commission on the road to understanding the metrics that are already being collected in this space, as well as where some of the gaps and challenges are. Cassie, from your vantage point, emphasizing the use of metrics as levers was very important to our understanding. And Lorna also bringing in the evaluation part of it and how important it is to be able to do course correction and to provide for some accountability in these processes. And finally, Chris, for really emphasizing and pointing out to us the substantial advances that have been made in attribution science, as well as some of the stuff that we still have to do in that space has been very informative. So you've provided a good evidence base now for the commission moving forward as we consider how metrics are going to fit into the overall deliverable that we're preparing. So thank you. Thanks also to the commissioners and members of the audience who contributed to this panel discussion. So we're going on another break at this point.